me to give the history?
Sure.
Is that
Great.
Yeah.
Yeah,
please do.
okay. I'll
You know
give
more of the
history.
legislative history than I do.
Okay,
Yeah.
please proceed, Senator.
Hi, I'm Elizabeth Steiner Hayward. I am the State Senator for District 17, Northwest Portland, Beaverton, and I'm here today to talk with you about Ballot Measure 111. Ballot Measure 111 came to you via legislative referral from a bill that we passed in the 2021 session to create a constitutional right to health care in Oregon. This measure had been tried, this bill had been tried many times before by the late Representative Mitch Greenlick, and I want to give him tons of credit for his commitment to ensuring that every Oregonian has access to health care across our state. And I was honored to continue that work along with many others during the 2021 session. Oregon has education as a right in its constitution, and that's why we have public schools in our state, and that's why the state pays for public education for every Oregon child. We do not, however, have the same right to health care. We are not unusual per se, but over a third of states already have health care as a right in their constitution, and it's states as diverse as New York and Mississippi.
Is that a recent phenomenon, or have those constitutions long reflected that?
It's a slow creep, I would say. It's been slowly increasing over time. Some of them started out that way, but a lot of them have added it over time. And we believe that having it in the Constitution in Oregon will change the way we think about policy in this state to allow us to focus a little bit more on a broad definition of health as we think about policy and a variety of other decisions. So we're excited to have this ballot measure there. We're excited to help make healthcare as important to Oregonians as education is, and as available ultimately. Currently, the state already provides health care for 1 in 3 Oregonians through the Oregon Health Plan. And although that number will shrink a little bit at the end of the public health emergency, it will go back up because we will be instituting the Bridge Health Plan, the basic health plan for people 138 to 200% of federal private level. We also provide health care for everybody on the Oregon Educator Benefit Board package and the Public Employee Benefit Board. So between those 3 programs, we are currently providing health care for about 40% of Oregonians, one way or another. Therefore, this is not a huge stretch to say that we ought to be thinking about what we do about the remaining 60%. Now, 25% of the state is covered by Medicare, which is, of course, a federally funded program. So really, that only leaves about 35% of Oregonians who either are in self-insured plans through their employer or small group plans or buy their health care through the exchange, their insurance through the exchange. So I think we have some great opportunities here, and that's why we put this ballot measure forward. Oregonians have long believed that health care is important. We've reflected that at the ballot time and time again, and I'm pretty confident that's going to happen again this year.
Great. Can the other 2 of you who are here just introduce yourselves so people who are watching know who we're speaking to?
Sure. Jessica Adamson. I'm the Executive Director of State Government and Public Affairs for Providence.
And I'm Travis Nelson. I'm a board-certified registered nurse, immediate past vice president of the Oregon Nurses Association, and state representative for House District 44.
So before we get into policy questions, I'd be curious as to what Providence's interest is, if you could sort of explain why Providence wanted you here to support this.
Absolutely. Providence has supported this measure since it was first introduced by Representative Greenlick, and we've been proud to support this all the way along because we believe that access to health care is a right. We believe that universal access to care is essential and should be available and affordable for all Oregonians, really for all of those within the Providence footprint and nationwide. Our belief is that when people have access to care, especially access to things like primary care and preventative care, that we can lower healthcare costs overall and keep Oregonians happy and healthy and build healthy communities, and that's an important public policy goal and frankly belongs clearly as a right in our Constitution.
And Travis, are you representing the Nurses Association?
I'm not representing ONA here today.
Okay.
I'm the immediate past vice president. I'm here in my capacity as a new state legislator.
Okay. Do you want to add anything before we start with questions in terms of your thoughts about why this is a good measure? Yeah, I'll just echo what Senator Steiner Hayward and Ms. Jessica were saying. It's just extremely important that we, as a state, come out strongly and say that healthcare is a human right, not at the expense of education and other programs, but we definitely need to make sure that we're doing more to provide health care for those who don't have it. We have a mental health crisis, as we can all see. People are dying because they can't afford to pay. And as a state legislature and citizens in Oregon, we need to do all that we can to bridge those gaps.
So, Senator Steiner Hayward, a long time ago, I think when Kitzhaber was first governor, the state passed something called the Quality Education Model. Are you familiar with it at all?
Oh, yeah.
So that attempted to establish a number which would provide a proper or adequate education for all Oregonians, and I don't think we've ever met that number, or rarely if we have. And I think in some ways it had the effect of establishing expectations for people that, hey, the legislature's acted on this. This means we're going to fund education differently and better. It hasn't happened. Do you have any concern that establishing healthcare as a right in the Constitution could have the same effect, that it will establish an expectation without any funding, without any mandate for things to actually change?
I think anything's possible as a concern. And what I also think is that currently Oregon has the highest rate of insurance of almost any state in the nation. Well over 95% of Oregonians have health insurance, and that includes undocumented folks or folks who are here on a green card but are in their first 5 years of documented residency here in the state, and that makes them ineligible for Medicaid. So we've changed that by creating Healthier Oregon, which includes Cover All Kids and Cover All People, because we believe in that. So we've gotten, between that and the Oregon Health Plan and all the other kinds of insurance that we have already, we've already done a great job of increasing access for Oregonians. There is nothing in this ballot measure or this constitutional amendment that says the state has a specific obligation for what kinds of health care or how much money it's going to spend. What it does say is we need to be thinking about this actively as a state legislature, as the executive branch, to really think about how each of our policies moves us closer toward that goal of keeping Oregonians healthier. I think the one other thing I would say is you're right about the QEM. I could argue that the QEM is aspirational and perhaps hasn't even kept up with the current understanding of the best educational methods for kids, or taken into consideration some of the changes we've seen because of the pandemic. Some good, some much less good. I think that one of the reasons that we don't do as good a job educating kids in Oregon is because we don't have families be as healthy as possible, because our families aren't as healthy as possible. So when parents are missing work because they're sick or because their kids are sick through preventable problems, or parents are unable to work because of chronic health conditions, that really has a significant impact on kids, and it causes trauma to them, and it causes them to miss school, and it causes them to perform less well. So we want kids to be ready to learn and maximize their possibility of learning well. And one of the ways to do that is to help everybody in Oregon be healthier.
Okay. Looking at the ballot title, it says state must ensure affordable health care access. So let's unpack that. Must ensure. What does that mean to you?
I think it means that the state has to look at everything that we and private employers are doing and understand how we come together to create a even more thoughtful health insurance and health access system. Because to be clear, having health insurance does not mean you have access. Mm-hmm. We know that in certain parts of the state, even people with insurance have trouble getting in to see even a primary care provider.
So I guess the point that I'd like you to elaborate on is must ensure. So in legislative language, we know that may means may. Mm-hmm. Must and shall mean you must. So it strikes me that if this ballot measure passes, as it's probably likely to do, as soon as it passes, there are going to be lawyers who take this to court and say, you must. You said, this ballot measure says you must ensure affordable health care access. Now, I know the second clause here is balanced against the requirement to fund schools'
Right.
other essential services, but it just feels like you're just inviting a lawsuit here.
You know, I think it'd be one thing if, as a state, we're moving backwards on healthcare coverage, but as a state, we have been moving forward incrementally, and I think this is just saying that we'll continue to do that, and we will continue.
No, it's not. It's saying you must insure.
But that's not, like you said, that's not the entirety of the phrase. It says balanced against other services.
Yeah, but
It's very clear.
Well, it's not at all clear because nobody has defined what that balance is. In clause 1, you're saying you will
I think
do something.
We've been clear with the intention.
On the record
right.
in the legislature.
Absolutely.
But the language comes first, and then you look at the legislative record to see what people said they meant. But this is crystal clear. Must insure.
So it doesn't mean the state itself has to provide it, first and foremost, right?
Right?
So we don't, if people already have insurance and access, then that's taken care of. And as I said, over 95% of Oregonians have health insurance right now. When we implement the basic health plan, we will increase that percentage as well. So we're already taking steps that will be implemented during 2023 to slowly but surely increase that percentage that have insurance. So let me say this threat of a lawsuit has come up multiple times.
Yeah.
We're a litigious society, unfortunately, right? People sue people or government entities for anything.
Yeah.
At any given time, the state has a bunch of lawsuits against it.
Yeah.
So is it possible, perhaps even probable, that somebody's going to sue us? Sure. But as Travis said, the legislative intent is clear. We were very clear during testimony, and I don't think that the courts can say that the state isn't already, as he said, making excellent strides in this direction, and nobody could expect us to turn on a dime and on January 1st ensure access for every single Oregonian.
So,
Sorry,
Go ahead.
Has Legislative Council offered any risk assessment or financial analysis of this?
Well, Legislative Council doesn't do financial analyses at all. That's up to Legislative Fiscal. And Legislative Fiscal didn't do a fiscal on this because, they didn't offer a financial analysis because of all the things I've already said. It doesn't mean that the state itself is responsible for paying for health insurance, right?
Sure. I guess I understand on the fiscal point taken.
Yeah, and to be clear, there's no fiscal on this.
No, I got it.
Okay.
I appreciate it.
Well, for people watching too, I
Well,
want to make sure that that's clear.
my question remains, though, did Legislative Council offer a risk assessment?
Legislative Council said, sure, people could sue. But they didn't say they thought it was likely, nor did they say that they thought it was likely that people would win. It's on the record, you can see it.
I'm sure there's public documents.
It's a public document. If you look at the bill, which is SJR 12 from the 2021 session, you can see under all the meeting materials for things that Legislative Council opinion is in there. Mm-hmm. And they say, yes, people could sue.
So what's the bill number again, sir?
SJR 12 in the 2021 session.
it almost feels as if people could sue and you sort of like them to sue, in the sense that if you went to court and it goes all the way up to the Oregon Supreme Court, and the Oregon Supreme Court says, yep, the Constitution says you must, then you're a lot further down the road towards single-payer health care.
You are putting words in my mouth, and that's not cool. Okay, I want to be really clear. This is not about single-payer.
Let me be very clear. If this were a single-payer bill, I would not be sitting here.
Why?
Because we believe that there are a multitude of ways to achieve universal access to care besides doing single payer. And Oregon has proven that. We have got a variety of programs that we have implemented with taxes that my company and others have been willing to pay to reduce the cost of healthcare on the individual market, to expand access to health insurance for a wide range of Oregonians. We have made significant investments along with partners like Project Access Now in trying to make sure that folks are signed up for programs that they qualify for.
Just to be clear,
Yeah.
single payer would probably result in less total revenue to the province system.
it depends on how you structure a system.
Yeah.
But we believe that if you respect Oregonians' right to choice and desire to make decisions about where and how they get their health care, and what they do and don't cover, that you can build a system that ensures universal access faster by identifying additional subsidies that are necessary, helping folks get signed up for care, trying to smooth the transition so you reduce the churn population, those on and off of Medicaid, a variety of other things that you can do to get to a place where Oregonians have universal access to care that's different than let's pull the system all the way off and institute a system where government pays for it all. And I will say that this is a very broad coalition of folks that have signed up to support this. Healthcare for All Oregon, if Tom Sisnick were sitting here, he would have a very different perspective, and I respect that. What we do share is a common value, that healthcare should be a right in this state, and that's really what a constitutional amendment should do. I mean,
how does this, sorry to interrupt, how does this jive? So, we all saw the story in the Times about, was it Project Rev Up at Providence? Was that what it was called?
I don't know exactly the name of it, but
you know what I'm talking about?
Yeah.
Okay, one of the things I took away from that story is that there's a hole here. These people are falling into a hole where they go to the emergency room, they don't have the means to cover their bills, and Providence has a method for getting money from them. How does this help that population?
So in Oregon and in a number of states, first of all, I'm not really here to talk about that story, but I am.
But doesn't that highlight
well, what I will say,
one of the things we're trying to solve here?
That is about financial assistance and what's available to Oregonians. I'm really proud that in 2019, Providence was the first health system to come on board and support House Bill 3076, which established minimum financial assistance standards that we have exceeded every year since. So I think that there is current law around financial assistance programs and what's available in this state and in many states, frankly. I think that what we're looking to do is how do we as a state ensure access to things like primary care? How do we make that easier for Oregonians? And we were proud to support a bill that Senator Steiner Hayward put forward that ensured that people have access to primary care, and that we do a better job of making sure that we can do those programs in a way that is more holistic.
I think the question Anthony's asking is, you established that Oregon has one of the highest rates of overall coverage.
Right.
There are still 5 or 7% of people who have nothing, and there are some people who are grossly underinsured. Those are the people that we're talking about. How would this constitutional measure make those people's lives better?
Again, I think it's important to point out that what Oregon is doing here is nothing new. That there are other states
I would like you to answer the question.
That have,
how does it make people's lives better?
I don't think we know yet, to be blunt. I will say this. There are data, for example, that looked at states before and after they implemented this kind of constitutional amendment and saw, for example, a reduction in neonatal morbidity and mortality, particularly in babies of color, in families of color.
But why?
Because when you have it in your constitution, you think about it when it comes to all of your policies.
Okay.
When that's in your constitution, because we think about education, we think about our constitutional requirement. I can tell you this from 11 years in the legislature. That's on our minds all the time.
Okay.
And if this is in our Constitution as well, we're going to be thinking about that.
Okay, so I want to come back to something. So you, in your legislative duties right now, are co-chair of the Joint Ways and Means Committee. Could you just explain for the benefit of people who may be watching this what a fiscal impact statement is?
Yes. Oregon has a budget, which I help craft. And when a bill is put forward, one of the things that has to happen is that the Legislative Fiscal Office, which is a nonpartisan group of professionals with expertise in this kind of work, look at a bill in conjunction with the affected agencies, executive branch agencies, and determine how much it's going to cost to implement it. Some bills don't cost a dime. Some bills cost an awful lot of money. When we passed Cover All People, we put $100 million towards that, right? Because we wanted to make sure that we actually had the money to provide the care to the people that we wanted to serve. This measure does not have a demonstrated fiscal impact because we were very clear on the record that this did not obligate the state to pay for more health care.
I'm sorry to be obtuse, but that's the problem I think I'm having is you in your opening remarks, and all of you have touched on this, you think this is a very important step forward in terms of our healthcare system. To a lot of us, that might mean, okay, that's going to make the lives of people who are currently suffering, who don't have adequate health care or access to health care, it's going to make their lives better. That's going to cost somebody something.
So that's true, and I would say that there are a lot of things that go into helping people have good health,
Yeah.
right? It is really tough to manage your diabetes if you're living on the street. So housing and permanent supportive housing for people with severe persistent mental illness
Yeah.
is one of the ways that we can go about guaranteeing that Oregonians stay healthy, right? So the state has already been investing a lot of money in those kinds of services, and to my mind, that qualifies as healthcare because it's impossible to be healthy if you are struggling with homelessness or unstable housing or housing that costs so much that you can't afford to pay for your medications.
Yeah. You said in the outset that education is the Constitution. Education is in the Oregon Constitution as a right. Are you sure about that?
I'm not sure I could quote you which article it's in, but that's,
Okay.
I mean, the Oregon Constitution is awfully long. So
Yeah.
my understanding is yes, and I have been told that that's true, and that's why we do this. But I could be wrong. I've been wrong before.
I think you may be wrong about that.
Okay.
But I'm not a lawyer. I looked it up quickly because I saw a reference to it in the ballot, in the statements for and against. But the question I have is, if the ballot measure, if we read the plain language of the ballot title and says the state must insure, what's to stop a large chunk of the population from saying, well, I'm paying a lot of money for my private health insurance, and now the state must insure access for me. I'm going to stop paying, and I'm going to go to Senator Steiner Hayward and Travis and say, hey, you said you must insure for me. Here I am, pay.
I think the key word is that we're not ensuring free access. We're not ensuring state-sponsored access. We are setting, if you get beyond the ballot title and look at what's actually in the measure,
Yeah.
it sets, frankly, from, again, a political science standpoint, what we should be doing in a constitution, which is establishing what are rights to Oregonians,
Right.
and not trying to get into all of the details. Our Constitution is an exceptionally long document because we put a lot of policy in there over the years.
Yeah.
This is what we should be doing, which is establishing what the value is, and then working through the legislative process on committees, through the legislative dialogue on what are the ways to achieve those values.
Mm-hmm.
And we have robust debate in those healthcare committees every year. In fact, they are among the busiest of committees because Oregonians care very passionately about all of that. And so achieving that goal, achieving that value will take time. But it focuses the conversation on we need to achieve this goal. The Constitution has established this as a right, and how do we continue to make progress for that 5% who don't yet have full access to affordable insurance coverage or don't have insurance coverage? How do we ensure that those folks get it? How do we continue to make it more affordable? How do we debate what a proper copay ought to be on insulin or what the maximum out of pocket over the year should be, as the legislature just did, and set a standard for what it should be, for what's affordable?
Yeah, now I'll just add that constituents can come to you with anything, right? They can come to you with, a variety of complaints, a variety of concerns. But that said, we've been very clear, like I said, about the intent of SJR 12. And bottom line is, we want to continue to move the ball forward, uncovering more people in Oregon.
Yeah.
That's the trajectory we've been on, and we'll continue down that path.
Sorry,
Go ahead, sorry.
I just want to say one other thing. In 2021, we passed Senate Bill 762, which was the big wildfire prevention reduction bill. One of the goals of that was to reduce small particulate matter in the air, because wildfires create enormous amounts of small particulate matter, and people with respiratory illnesses, or even people who have perfectly healthy lungs, have significant challenges when the air quality drops precipitously due to wildfires. And that's been true in this city, right? Any of us who lived here in 2020 know that, right? So when the state does things like that, that's improving health for Oregonians. When we do things like focus on reducing small particulate matter, ensuring clean drinking water for every Oregonian, improving sewer systems so that we don't dump sewer water into drinking water or into our rivers, all of those kinds of things, all those public health measures go toward meeting the goals of SJR 12, of ballot measure 111. Every
But
single
you're saying
one
you
of
have to
those.
look past the title to get to that, right?
Yes, and we testified about all of that when we were
I guess I
talking about it.
don't want to get hung up on the title, and I hear you that there's more beyond that, but I'm getting the thing that keeps popping into my head is this feels a little like regulated militias in the Second Amendment. I mean, just take it as
That's a comparison.
Okay, yeah.
But listen, how often does the Supreme Court even look at that? I mean, it's got to be the most confusing, tragic
It is.
piece of language in the Constitution, because it's completely ignored by
agree.
the current,
I agree. Although
courts.
Scalia didn't do it in the
And I just
DC
wonder
decision.
if this is the predicate phrase you have there about education is going to sow confusion about what are we doing here? And I almost wonder, should you go big or go home? Should you say there's going to be health care regardless?
No.
Or
We can't promise
what
that.
is this phrase?
If we're going to make a promise, we're going to know we can keep it. I do not know that I can guarantee you that right now the state cannot pay for health care for every single Oregonian. We can't.
So this is aspirational.
Well, no. What's aspirational, and I think is doable, is to ensure access to health care and good health for every Oregonian. I think that's doable. I don't think it's reasonable to expect the state to pay for it all, and we've been very clear about that. But we pay attention to these things in a whole bunch of different ways. All those things I said, everything we do to reduce small particulate matter in the air, everything we do to make sure that there's clean drinking water, everything we do to make sure kids are well educated, because you cannot be healthy if you're not well educated. If you can't understand how to have a conversation with your healthcare provider about how to manage whatever chronic condition or how to ensure a healthy lifestyle, if you can't read your prescription bottle and follow the instructions properly, it's impossible to be healthy, right? So well-educated people are healthier people, in part because they have higher incomes, and we know that people with higher incomes are healthier. So everything that we can do to ensure that Oregonians are well-educated and that we have a sustainable economy will go towards improving the health of Oregonians also.
So I want to correct myself that the issue of whether the Oregon Constitution guarantees the right to education has been litigated over and over again. The last decision said that it does. So you're correct about that. It's still, I want to touch on that issue for just 1 second, because we've been in this room, and I think with you before, talking about public education, how we fund it, is it any good, how can it get better? Many of the wealthiest people in this state send their children to public school, which is a great thing. If healthcare becomes a right, why wouldn't many of the wealthiest people in the state say, well, look, I have a right to free public education, I have a right to public safety, I have a right to healthcare, pay for my kids? We're paying for their kids to go to school.
Well, we're all paying for their kids to go to school, and they're paying for it too.
Sure.
Right? Because
But
most of them
we're all paying toward healthcare as well.
Right.
Well, I'll just add, I think there's a difference there, right? The Constitution has said that the state has an obligation to provide education.
Right.
This ballot measure does not say that the state has to provide health care to everybody. So I think that's a distinct difference. That's got to be noted.
It says it must provide access to health care.
But it doesn't say the state has to provide that. And I think that's the difference between the state having to provide education and the state having to provide health care. We're not eliminating private insurance companies.
We don't want to.
Obligates the state, this is a summary, obligates the state to provide Oregon residents access to cost-effective, clinically appropriate, and affordable health care.
So We're doing that. We're already doing that in many, many different ways. From all the things that Jessica said, in our partnership with private insurers and hospitals, all the things we're already doing with the Oregon Health Plan and with the task force that Representative Prusak and I are co-chairing about the basic health plan, which will create essentially something that looks like the Oregon Health Plan for people 138 to 200% of federal poverty level, with the Children's Health Insurance Program that ensures every child up to 300% of federal poverty level has health insurance, with Healthier Oregon, which covers undocumented kids and adults now in this state, and where we're making significant inroads.
Everybody would recognize.
What percentage of children are covered in Oregon?
In Oregon, it's about 98, 99%.
Nobody's disputing that, or I think everybody would stipulate to those facts that the point is that you're asking voters to vote for something new. What they're getting from that is amorphous. It's unclear. It's not clearly defined.
It's new, but it's not a new concept. Other states, as we've already said, have already gone down this road.
But see it from our perspective. You're saying that you're going to enshrine in the Constitution, which is it doesn't get amended very often. It's a pretty serious step to amend the Constitution. We're going to enshrine this right in the Constitution, but it doesn't cost anything. So I'm going to give you something that's really valuable. It doesn't cost anything.
Well, I think, from my perspective, it's a value statement, and I think there's a reason why there is no opposition to this ballot measure. It's pretty rare.
No organized
Or no organized,
Yeah.
thank you.
It's a value statement, but the Constitution is not about value statements.
Well, no, actually the Constitution is about value statements. That's why the U.S. Constitution has the Bill of Rights. That's why the Oregon Constitution has a variety of other, like Oregon's Constitution has a broader free speech. The Supreme Court in Oregon says that Oregon's free speech protections are even broader than the U.S. Constitutions, right? Those are value statements that are in our Constitution already.
And
Right?
frankly, that's what a constitution should be about, is value statements. We happen to have a process in Oregon that has allowed a bunch of policy to be in there. And frankly, as I've watched that happen over time, there's been a lot of criticism that what we have is a system where we do put very specific policy solutions into the Constitution that make it very difficult to change.
No doubt, yes, the kicker, chief among them.
Measure 111.
Yeah.
Measure 11.
50.
Measure 11.
God,
You will
property
fix that.
tax law,
Sorry.
Very specific.
That's the
And
problem. It's 111.
Yeah, that
Right?
47, 50, 5,
Five.
all of
Yep.
those
Yep.
that have come in and been very specific, and not given the legislature the ability to make changes over time. Healthcare policy is complicated, but saying this is the value for Oregonians, which, as Senator Steiner Hayward said, they have shown up and said, this is really important to us. And then being able to, over time, find different policy solutions as the federal government makes changes, to be able to work in concert with them, because what we have is private healthcare, federal healthcare, state healthcare that all work in partnership, and those pieces are constantly moving. And so our ability to piece that together and find ways to expand access to healthcare needs to be nimble and not rooted and specified in the Constitution.
Steiner Hayward, I think you were involved in a mental health parity bill.
Yep.
When did that pass, if you recall? I'm not holding you to it, but.
I'm going to
let me
say
ask you-
2007,
Let
but
me ask you a
I
better
bet
question.
I-
What did that bill attempt to do?
that bill attempted to say that people who provide mental health services should be reimbursed on par with their counterparts who are providing physical health services. And I know what the next question is going to be is, did it work? And the answer is not as well as it should have. And that's one of the reasons that the Department of Consumer and Business Services did a data call to demonstrate that, and is starting to hold insurance companies that are not doing that accountable. We have a long way to go on mental health, and we know it. But we've made substantial investments, especially over the past 2 years, because we understand that access to health care means access to mental health care as well, right? Whether that's substance use disorder treatment or for any kind of mental illness. Again, if you're really depressed, it's really tough to take care of your diabetes.
So I know that DCBS is in the process of examining how close we are to parity. Nobody would say we're at parity. Doesn't the legislature have the ability to essentially force parity? either through the Oregon Health Plan or by
Well,
requiring
in the
private
Oregon Health
insurers?
Plan, we do. In the Oregon Health Plan, we're doing a damn good job of it,
You think
right?
we're at parity or close to
I think we're
parity?
close, and certainly with the increases we did in behavioral health reimbursement in the 2022 session, 21 and 22, I think we've made substantial progress. Is it as good as I'd like it to be? No. But that's one of the reasons that, for example, we're increasing the metrics for CCOs over time about provision of mental health services. Oregon's behavioral health system has been neglected for decades, right? And we're working hard to fix that, but it's going to take us time to revamp it and figure out the new partnership with the counties that have been doing this, what role the CCOs play, what the roles the counties play. But that's all part of a holistic understanding of health.
So it's great that we put $1.3 billion in the recent cycle into new mental health funding, and it's great that, and I'm sure you'll be holding people accountable as we move toward parity, but it feels in a way like we're putting this measure into the Constitution before you as the legislature has sort of done what it set out to do with parity. This could feel like a bit of a diversion, like, hey, look what we're doing for you. We're giving you a new right. We're enshrining a new right in the Constitution. We haven't actually taken care of mental health. I mean, yes, we've made big strides, but we're way behind where you have all said we want to be. So this is a feel-good measure before we finish doing other hard work.
It's the thing that enables us to do it and gives us the constitutional imprimatur to do it.
So this
right?
will help you get there.
Help us get
Okay.
there. It will help us unify all the work we're doing. You know that Oregon just received a federal approval for a new Medicaid waiver
Yeah.
last week.
Yeah.
That is one of the most exciting things I've seen perhaps in my lifetime and certainly in my career as a physician, because it finally recognizes that things like housing are critical to health, right? And we've got federal government approval to use federal funds with state match, as we do in our Medicaid program, to help get people into housing, keep people into housing, help people in transition out of the foster care system, help people in transition out of incarceration, right? All of those things are about keeping people healthy. All of those things go toward what Measure 11 will provide. Because if people don't have a stable place to live, it doesn't matter what kind of health insurance they have. It doesn't matter how many primary care or subspecialist doctors they see.
Yeah, this moves us down the road. Again, we look at it as another step to just continuing to cover more and more Oregonians.
So in the, I promise to be the last time I ask about the plain language. So it anticipates that you're going to get sued, right? Because it says the courts must balance the need to provide health care against education and other services.
Name me something big we've done in the state that we haven't been sued about.
So going into something knowing you're likely to get sued, did that change the way this measure was written? Did it change the way you
This
thought
measure
about it?
is identical to the measure that would have passed in 2020 had the Republicans not walked out. It passed the House in 2020, and it would have passed the Senate if we'd had a quorum. And it would have been on the ballot in 2020. And we would already be working on this if the Republicans hadn't walked and denied us a quorum. It is identical.
Okay. So, just if we could conclude, I want to come back to the quality education model, which again is not the same thing, but was an aspirational measure that the state held out to parents who were very unhappy with the level of education funding in Oregon and said, we now have a model that tells us what full funding looks like. And we've never gotten to it, and it's a little bit of I mean, if you, as I'm sure you have, you probably comes across your desk every 2 years, they have to file a report that says, once again, we did not reach the aspirational goal. So why, I want you to restate why this will make Oregonians' lives better. How and why this is going to make people's lives better?
I would say two things.
In concrete terms.
Okay, I want to say two things about this. The first thing I want to say is having the QEM, the quality education model, has pushed us every biennium to think hard about funding and how high can we go when we balance education against all the other things. Frankly, if we didn't have so many people incarcerated in this state, we would be able, which is thanks to Measure 11 and other ballot measures that put sentences into our Constitution, speaking of policy. If we didn't have so many people incarcerated in Oregon, we would have more money to spend on education. Because we have to pay for people in prison first, right?
Yeah.
We don't have a choice. They are in prison, we have to pay for them, right? So if that weren't true, we'd free up a lot of money to go toward education and other things that are really important to Oregonians and that I would argue make Oregon a healthier, safer, economically more stable state. So that's the first thing I would say. The second thing I would say, it's going to be three things actually. The second thing I would say is passing the corporate activities tax in 2019 made a huge difference in getting us toward important services and important educational initiatives in every district in the state, right? And we're still seeing the impact of that because, thank you pandemic, we haven't really had a chance to see how that really all plays out. So we're going to be watching that very closely over the next several years. And as a corollary to that, the reason that we can't pay for the QEM is because of ballot measure 5 and ballot measure 50, which limited property tax and changed our land use laws, right? So we have hamstrung ourselves as a state by passing those ballot measures and putting in proper. So you asked a specific question. I'm getting there. I promise.
Can I interrupt you before you
Sure.
get there? And I'm going to give you the floor back. So you just mentioned 3 ballot measures that we have talked about in this room for as long as we've had this room. The property tax limitations and the mandatory minimum sentencing guidelines that have both hamstrung revenue with property taxes and have required mandatory spending and kept large numbers of people incarcerated. The Democrats have a big voter registration advantage in the state. They have control of the legislature, supermajorities. Why haven't you as Democrats who object to these pieces of legislation or these ballot measures that became part of the Constitution, why haven't you sought to overturn them?
We have overturned parts of them already.
Parts of Measure 11 have been overturned.
Past Measure 11
Agreed.
and 57 have been overturned, and we have changed that, especially with regard to kids, which is really important, right? Ballot measure campaigns for things like that are really tough. They're really, really tough to do, and they're really expensive. And we've had some other really expensive ballot measures in this state that have gotten some important things done and some that have gone down in flames, right? And I think that one of the questions that we have to ask is, what's the best use of available resources? Do I think those things should be out of the Constitution? Those things and the kicker? Damn straight I do, right? We have, between the past 2 biennia and this one, we're going to be pouring something like almost $5 billion back out via the kicker. $5 billion that could go towards meeting the QEM or providing health care or reducing the number of people who end up in prison by offering services to people who are at risk, right? By getting people into housing and helping them have a stable life, by getting them job skills. So all of those things are things that should not be in our Constitution. And if I were queen of the world and had infinite resources, they wouldn't be. But all of those, getting rid of all 3 of those things requires significant education of the public. Just because you're a Democrat doesn't mean you're going to vote in favor of getting rid of the kicker. There's a lot of negatives in that sentence, but you know what I mean. Right? So just having supermajorities, just having registration edges, those 2 things are not sufficient. They are necessary but not sufficient to make those changes in the Constitution. But Oregonians, regardless of voter registration, have demonstrated time and time again that they believe that health care is important for every Oregonian. Ballot Measure 101 was successful in every single county in the state, I believe. It may be one or two that didn't. But rural, urban, coastal, Eastern Oregon.
Just for the sake of our ignorance.
And I just wanted to,
I remember the measure, but remind us what it did.
Yeah.
what,
About-
Measure 101?
Yeah.
Well, I'll
Go
let you
for it.
take your shot at that, but I just want to point out that the largest block of voters in Oregon are actually non-affiliateds now.
Yeah.
Yeah.
And not either Democrats or
Isn't
Republicans.
that because that's a lot of motor voter, isn't it?
It's a lot of motor
Motor
voter,
voter, yeah.
yeah.
Ballot Measure 101 was the one that Jessica has alluded to because in 2019, we passed legislation, 17, I'm sorry.
It was, yeah, it
I'm
was the
really bad at
budget
dates.
Yeah, yeah.
Can I just
answer that
Sorry,
question?
yeah, I'm sorry.
So, in 2017, we worked closely with the insurance companies and the hospitals to implement what the federal government calls provider taxes, where insurance companies pay a small percentage of premiums to the state, hospitals pay a small percentage of their revenues to the state that we then use as part of the general fund revenues that we use for federal match to get draw down Medicaid dollars to help provide health care for currently 1 in 3 Oregonians, right? And people did a signature petition and got it on the ballot because they didn't like it. I don't really understand why, the people who were most directly impacted.
It's like a 3-to-1 match, isn't it?
Yeah,
It's a big deal.
It's a 3-to-1 match. And the insurance companies and the hospitals were great partners to work with,
Yep.
and were totally copacetic.
Sorry, I diverted you completely from answering my question, which is how people's lives are going to be materially better when this passes. if this
Instantly, they're
passes.
not.
Yeah.
Instantly, they're not. I'm not going to make promises, Nigel. I don't do that, right? Instantly, they're not. That being said, when this passes, because I believe it will, in 2023, as we look at policy and budget decisions, those decisions will be influenced by this constitutional change. And as we think about how to structure the services, the policies, the statute, the budget that impacts the life of all of those impact the life of every single Oregonian one way or another, all of those will be done in light of this change in our Constitution, or the vast majority of them.
Can I say something about the QEM? I was very early in my career. I was staffer to the late Lynn Lundquist, the session after he was speaker back in 1999. That was the session that the QEM work was just finishing and the first reports were being published. And so I kind of had that inside look of what that looked like, again, very, very, very early in my career. And he, the goal of Speaker Lundquist, or the former speaker at that point, was to try and set a conversation about what does a fully robust education look like? What does it mean to have arts in every school? And STEM wasn't even referred to as STEM back then, but these broader opportunities of hands-on learning and career technical and frankly access to mental health services and other health services that were necessary. What does it cost to fund that? And it didn't change the conversation overnight because there wasn't the resources to change it overnight. But if you look at where education was then and where it is today, and what more schools are adding, what the legislature has done to make access to mental health, access to STEM education, access to CTE, the ballot measures that have come to fund how do we make sure that kids are on track to finish high school, there has been a sea change.
Do you have kids in public school?
My son graduated from high school. Graduated last year.
Okay. I have kids in high school.
Yeah.
They grant. Yeah. Some things, anyway.
There are challenges, and not every high school offers
Yeah.
everything the
Well,
same way.
They're dropping things like, physics with calculus
Yeah.
in favor of classes, literally called walking. Okay, so I know it's an anecdote, but I just, with all due respect, we had 2 kids at Providence. It was great. Had a great experience. Dr. Joe Sullivan was like,
Oh, Joseph, I love Joe.
He's a god.
I've known him forever.
he's a god.
Joe's great.
He kept me from getting back surgery. Lots of great stuff. I worship at his feet. I'm a little bit queasy, and tell me why I shouldn't be, about Providence being here advocating for this measure, when if what they say in the Times is correct, you guys were kind of beating up people to get money out of them for emergency room visits when you're a nonprofit with an $8 billion hedge fund. that's embedded in it. And I'm wondering, instead of doing this, is there some change we could make to get that $8 billion freed up to take care of those people that are visiting the emergency room and then being ending up with these bills that are destroying their credit reports? I'm not trying to be. I just want to understand that.
Well, let me finish on what I was trying to say here, and then I promise I'll come back. The QEM forced a conversation that over time has driven how we have improved education in this state. It's not perfect. It's not there yet. As you've rightly said, we've never reached it. The hope is that this measure will drive a conversation, because it's now a value in our Constitution and a right, that will continue to improve healthcare over time, which is why Providence has been supporting this measure since it was first introduced, because it is important that we continue to work over time to expand access to care, that we continue over time to reduce the number of uninsured. So your question to me is about a series of about a separate papers reporting, and there's a lot there, and I'm happy to connect you with folks who can talk to you very specifically about that. Let me say a few things. Last year, Providence provided in Oregon over $65 million in free and reduced care in our communities. We're very proud of that number. That number has grown. Our total community benefits have grown year over year from 2020 to 2021, and we're proud of our continued commitment to the community. And we'll continue to invest in our communities, because that's what we're here to do, to provide health care, to support our communities, to make investments, and to make care affordable and available. That's why we're here. That's why we lean in on discussions, and why our number one priority for years has been fully funding the Medicaid budget, so that we can ensure more and more Oregonians have access to care. It's why when the taxes changed in 2017, and they were in fact a true tax, and they were very different and have an impact on our bottom line, we stood up anyway and said, access to care is too important. It's the right thing to do. We made a deal with the legislature to ensure that we continued in a tough budget time to have access to care, and that we could reduce the cost of care for those on the individual market at a time when not every county had multiple choices for carriers. We stayed. Providence is here advocating for this measure because we need health systems in this state that continue to value health as a right. And that's important. We are largely a nonprofit healthcare state, and that means that people stay here and provide care here, even if it doesn't meet everyone's bottom line all the time. I don't think it's a secret where folks are at in terms of financial stability in the health system, and that's not what we're here to talk about today. It's really about what's best for Oregonians, and we believe that it's essential that we set that health is a human right, that we put that in our Constitution, and that we continue to work to get better and to provide better access. And that's what we're about every day. That's why we're here.
Yeah, and I'll just
Seems
say,
like you have a little more capacity given the hedge fund.
Well, it's not a hedge fund. So let me just deal with that, because you've called it a hedge fund multiple
I
times.
think the Times called it a hedge fund.
Well,
It's an
is.
investment fund, isn't it?
We have
it makes
reserves.
investments in health companies.
We have reserves.
Yeah.
We are required to have reserves. The state we are a health plan. Part of those reserves
Yeah.
are requirements that the state has, so that if something happened tomorrow, we could pay out claims, so that we can bond and improve facilities for earthquake safety and for other needs that come from the community.
So it's like an insurer owning debt or properties to continue to pay out
we have
claims.
Yeah, that's part of what
Okay.
those reserves. So we have reserves. We're required to have reserves. It's financially prudent for us to do that, and it's necessary, so that as funding comes and goes, government's a major payer. As things take time to come in, we are able to sustain and keep employees and pay our debts. All of that's important. So, again, not here to talk about that, but given that you've raised this multiple times,
I guess I'm like Nigel. I can't pull apart healthcare and money.
Well,
I think the problem.
I mean, the big problem in healthcare is money.
Right.
It's the one good
no,
that
there's right. So
You know, it's the one good that's not price.
okay, that's a whole. I mean, that would take an hour and a
Okay.
half conversation all by itself.
Sure, well,
If
this
you
is-
really want to have that
It's a good
conversation
opportunity.
anytime,
I mean,
it's a good opportunity, and
it's, yeah.
you know, we have. I don't have another
Sure.
hour and a half to
Sure.
talk.
And I'll just say, I'm a nurse. I was in leadership at ONA. We've had a lot of differences with Providence over the years, but we're on the same page with this again, right? We look at this as a value statement, and we need our hospitals, and we need to move the ball forward in Oregon, and we've all got to work together.
Okay, one last question. Where you have had states put some language like this into their constitution, have there been improvements?
I think
Numbers.
so. I mean, New York was
And
one of
who's
the
done
first.
best?
Well, I don't know the answer to that question. I think depends on how you define health, right? And define healthcare. And different states do it different ways. I spend a lot of time talking with colleagues across the country who are in the healthcare space. I go to national conferences. I'm on national task forces about this stuff. And I can tell you that the vast majority of states are doing something interesting, because healthcare is important to every
But there's
single
no
state.
any data on this?
Not,
Could
I
you
mean,
do
I don't
comparisons?
think it's
Levels
real.
of coverage before and after?
You probably
you could-
could. I haven't,
Brazil
I haven't,
guarantees a right to healthcare and a lot of other things, right? I mean, that part's easy in a way.
Yeah, I don't know,
What
like
do you
we
guys-
put
how
together,
much are
but
you
I'm sure
spending on
that
this
data is.
we're not, I'm
Is
not,
anybody spending any money to advertise
a little
this
bit,
or
but
do
not a
anything?
lot.
Okay.
I don't think, I mean, I think that, I don't know what the budget for the
Okay.
campaign is. There is a budget, but it's not very
It's
much
not-
money.
okay.
It's not a ton of money, because this is mom, God, and apple pie to Oregonians, honestly.
We are out of time.
No fun question?
No
Break
fun
the ice?
question for this, no, that's
Okay.
not, that's only for candidates.
That's tomorrow, I think.
Thank you all very much, you've been really great.
Yeah, thanks for your
Answering our
patience.
questions. Thank you.
You're welcome.
Thank you.